This integrity session is focused on sleep and rest. Although more detailed, I believe you will find that the comprehensive information provided will help you to understand your reading material. Physiology of Sleep. Rest is the repose of the body due to sleep. There is freedom from activity of the mind or body. It means that one should lie down and cease from motion. According to author Kozier at the time, rest meant calmness, relaxation without emotional stress, and freedom from anxiety. The nature of sleep is thought to be controlled in the lower part of the brain. Sleep is a state of altered consciousness throughout which varying degree of stimuli is produced wakefulness. Again, sleep is a state of altered consciousness throughout which varying degree of stimuli produces wakefulness. Sleep is characterized by being productive and restorative. Functions of sleep. It restores physical well-being, relieves stress and anxiety, restores one's ability to cope and concentrate on activities of daily living, is an active and complex rhythmic state involving a repeated cycle, and it is the most familiar biorhythm known as the circadian rhythm. The term circadian means, quote, about a day, end quote. The types of sleep involve non-REM sleep and rapid eye movement. Most sleep during a night is non-REM sleep or non-rapid eye movement sleep. Non-rapid eye movement sleep makes up 5 to 50% of sleep time. Non-rapid eye movement sleep is divided into 4 stages. During stage 1, NRE sleep is called transitional stage. During this time, the person is between wakefulness and sleep. The person is in a relaxed state, but is still aware of their surroundings. Their eyes roll from side to side. The person experiences involuntary muscle jerking, and this stage lasts only a few minutes. It makes up 5% of the night's sleep. Stage 2 and Stage 3 of non-rapid eye movement sleep. During Stage 2, the person can be aroused easily. It makes up 50 to 55% of the total night's sleep. The body processes continue to slow down and last only about 10 to 15 minutes. During Stage 3, the person gets a deeper sleep. Arousal becomes more difficult for the individual. Skeletal muscles are very relaxed. Snoring may occur during Stage 3, and it makes up about 10% of one's night's sleep. Person reaches the greatest sleep known as delta sleep during this time period, and it makes up 10% of the total sleep time of an individual. The person is difficult to arouse, and eyes usually roll during this time period. Some dream begins to occur. Physical changes that occur during delta sleep include brain activity slows, a decrease in pulse and respiratory rate, decrease in blood pressure, and the muscles are very relaxed. Metabolism slowed, Body temperature decreases. Read your information as relates to non-rapid eye movement sleep in your text, along with other information as found in your main points of your syllabi. Now we will turn our attention to rapid eye movement sleep, or REM. The person is more difficult to arouse during rapid eye movement sleep. It takes up 20 to 25% of nightly sleep time, and if awakened during REM stage of sleep, the person always report that they were dreaming. Many scientists believe that everyone dreams but can't remember dreaming. The pulse, respiratory rate, blood pressure, metabolic rate, and temperature increases during rapid eye movement sleep, but skeletal muscle tone and deep tendon reflexes are suppressed. Physical characteristics of REM sleep include: you have back and forth movement of the eyes rapidly. The muscles twitch. Large muscles are like they are paralyzed. Respirations become irregular and increased. Gastric secretions increase during REM sleep. The pulse is rapid and irregular. EEG findings will show an increase in brain activity. Conditions that promote sleep. The patient feels he or she is in control of going to sleep. When a person feels accepted by hospital staff, they can relax and be free from worry. The patient understands what is going on, is able to relax and sleep better. Freedom from irritation or discomfort occurs that promotes sleep. When one can rest, he or she has a satisfying amount of activity. Activity of the mind is another condition that promotes sleep when one is relaxed mentally. The patient must know he or she will receive help. Sleep cycle. During stage 1, which is the transitional stage, one is relaxed. Stage 2, person awakens easily. Stage 3, they are difficult to awaken. Stage 4, the delta sleep, is the deepest sleep. Stage 3, going back, person difficult to awaken. Stage 2, awakens easily. REM sleep, you have the person dreaming. And stage 2, they are easily awakened. You see how the cycle reverses itself. Each stage lasts 90 to 100 minutes. Normal sleep patterns and requirements for sleep. For newborns, they require 14 to 18 hours of sleep. Infants, 12 to 14 hours. Sleeps longer at night, usually 8 to 10 hours required. Toddlers sleep about 10 to 12 hours a day. Most sleep occurs during the night for the toddler. Preschoolers sleep about 11 hours at night, 20% REM sleep. At age 5, you have the preschooler taking daytime naps being relinquished. During the toddler period, you had them taking naps. School-age child sleeps about 10 hours at night. Sleep time remains relatively constant. Adolescents sleep about 8.5 hours a day. Young adults sleep 7 to 9 hours a day, but time varies. The middle-aged adult sleeps about 7 hours a night, often suffer with insomnia. The sleep pattern for the elderly adults. Sleep about 7 hours a day. 20 to 25% of that sleep is REM sleep. Stage 4 sleep is markedly decreased in the elderly populations, and sometimes stage 4 is absent. The first REM period for the elderly adult is longer. They may awaken more often during the night. It takes longer for the elderly adult to fall asleep. Now we will look at factors affecting sleep. Illness. People who are ill require more sleep than normal, and the normal sleep rhythm of people who are ill require more sleep than normal, and the normal rhythm of sleep and wakefulness is disturbed when one is ill. Environment. The environment can promote or hinder sleep. Changes in environment, such as noise level, can inhibit sleep. People sleep best in their homes. Lifestyle. Examples include moderate exercise usually is conducive to sleep, but excessive exercise can delay one's sleep. They need to unwind. Psychological stress. Anxiety and depression frequently disturb sleep. Alcohol and stimulants as another factor. People who drink an excessive amount of alcohol often find their sleep disturbed. Excessive alcohol disrupts REM sleep, although it may hasten the onset of sleep. Medications. Some medications affect the quality of sleep. Hypnotics can interfere with stage 3 and stage 4 non-rapid eye movement sleep and suppress rapid eye movement sleep. Beta blockers have been known to cause insomnia and nightmares. Narcotics such as Deprivation and morphine are known to suppress rapid eye movement sleep and cause frequent awakenings and drowsiness. Amphetamines and antidepressants decrease rapid eye movement sleep abnormally. Tranquilizers interfere with rapid eye movement sleep, and withdrawal will cause an increased rapid eye movement sleep, and maybe nightmares can occur. Some common sleep disorders. Primary sleep disorders are those in which the person's sleep problem is the main disorder. Examples include insomnia, hypersomnia, narcolepsy, sleep apnea, and parasomnia. Secondary sleep disorders are sleep disturbances caused by another clinical disorders, such as thyroid dysfunction, depression, or alcoholism as secondary sleep disorders that lead to sleep problems. Insomnia. Insomnia is the inability to obtain an adequate amount or quality of sleep. There are 3 types of insomnias. You have difficulty falling asleep, which is the initial insomnia. Difficulty in staying asleep because of infrequent or prolonged awakening. This is intermittent or maintenance insomnia. An early morning or premature awakening known as terminal insomnia. Insomnia can result from physical discomfort, but more often it is the result of mental overstimulation due to anxiety. Hypersomnia is the opposite of insomnia. It means excessive sleep, particularly in the daytime. Hypersomnia and this is the correct spelling of the word, can be caused by medical conditions such as central nervous system damage and certain kidney, liver, or metabolic disorders such as diabetic acidosis and hypothyroidism. Narcolepsy. Narcolepsy is a sudden wave of overwhelming sleepiness that occurs during the day, refers to as a, quote, sleep attack, end quote. In narcoleptic attacks, sleep starts with the rapid eye movement phase. People with narcolepsy sleep well at night. They nod off several times during the day, even when conversing with someone or driving a car. Sleep apnea. Sleep apnea is a periodic cessation of breathing during sleep. This disorder may be suspected when the person has loud snoring, frequent nocturnal awakening, excessive daytime sleepiness, irritability, intellectual deterioration, or other personality changes. Periods of apnea may last from 10 seconds to 2 minutes, occurring during rapid eye movement or non-rapid eye movement sleep. There are 3 common types of sleep apnea. The first is obstructive apnea. It occurs when the structures of the pharynx or oral cavity block the flow of air. Enlarged tonsils can lead to obstruction, a deviated nasal septum, and nasal polyps predispose the client to obstructive apnea. Central apnea is thought to involve a defect in the respiratory center of the brain. All actions involved in breathing, chest movement, airflow cease. And you have mixed apnea, which is a combination of both central and obstructive apnea. Parasomnias. Parasomnias refer to a cluster of waking behaviors that interfere with sleep. Somnambulism involves sleepwalking. It occurs during stages 3 and 4 of non-rapid eye movement sleep. It occurs 1 to 2 hours after one falls asleep. Sleepwalkers tend not to notice danger and need to be protected from injury. Sleep talking is another parasomnia. It occurs during non-rapid eye movement before rapid eye movement occurs. Rarely presents a problem unless it disturbs others. Nocturnal enuresis is a condition where warm bed wets during sleep. Usually occurs in children over the age of 3 years. More males are affected than females. Nocturnal erections is a condition where you have nocturnal erections and emissions occurring during rapid eye movement sleep. They begin during adolescence and do not present a sleep problem. Bruxism occurs during stage 2 non-rapid eye movement sleep. It involves clenching and grinding of the teeth and can eventually erode dental crowns and cause teeth to become loose. Sleep deprivation. Sleep deprivation is a prolonged disturbance that results in decreased amount, quality, and consistency of sleep. It produces a variety of physiologic and behavioral symptoms. 2 major types of sleep deprivation are rapid eye movement deprivation and non-rapid eye movement deprivation. Rapid eye movement deprivation. Clinical signs include excitability, restlessness, irritability, and increased sensibility to pain. With non-rapid eye movement, you have withdrawal, apathy, hyporesponsiveness, lack of facial expression, and excessive sleepiness. During a sleep assessment, you want to obtain the individual's sleep history, which includes their usual sleep pattern. How many times are they awakened during the night? The quality of sleep. Do they take naps during the day? What is their bedtime ritual? Do they use medication for sleep? How long have they been using medication for sleep? And the effectiveness of the medication. What is their sleep environment? Is it dark, warm, quiet? Has there been a recent change in their sleep pattern? Explore sleep difficulty. What do you mean? Describe it. The source of sleep difficulty. How long have you had the sleep problem? What are you doing about it? How do you handle it? Have the person maintain a sleep diary, a written record of sleep activity for 1 week. The client can provide more precise information of their sleep pattern in the diary. The diary information may include all of the following information that pertains to the client's specific problem. The total number of sleep hours per day. Activities performed 2 to 3 hours before bedtime, which should include the type of activity, the duration, and the time. Medications being taken. How did you feel when you woke up? Bedtime rituals. Time of going to bed. Trying to fall asleep. Falling asleep, approximate time, and any awakening during the night time they woke up in the morning. Assessment and physical examination. Note the facial expression of the individual. Is the client's facial expression appropriate? Is it mask-like? Do they have dark circles under their eyes? Behavior and energy levels should be assessed, noting if they are irritable or calm, restless or inattentive. Is their speech clear? Note their coordination and determine if it's appropriate. Is there poor posture? Are they yawning? Do they have heavy eyelids? For obese individuals, extremely obese, does it interfere with their ability to sleep? Note other physical problems, such as congestive heart failure, respiratory conditions, such as asthma, allergies, bronchitis, etc. Are there nasal problems, such as the presence of a deviated septum? Do they have problems snoring? Have they been told that they snore? Signs and symptoms of sleep deprivation. Dark circles under the eyes, puffy eyelids. Red eyes. Physical discomfort such as headaches. Dull or very excitable. Limited facial expression. Rubbing of eye or eyes. Hand trembling. Confused behavior. appear withdrawn, not much energy. The client goals should include the client will maintain a sleep/wake pattern that provides sufficient energy for today's activity. By whatever the designated date, the client will identify 2 rituals that will assist him or her in falling asleep more easily. By designated date, the client will show no signs of sleep deprivation. Criteria: the individual verbalizes he or she feels less fatigued, attentive to teaching that is given, able to learn new skills, diagnosing sleep pattern disturbance is a NANDA nursing diagnosis given to clients with sleep problems. It is defined as a state in which the individual experiences a disruption in the amount or quality of sleep, causing discomfort or interference with desired lifestyle. Defining characteristics include complaints of difficulty falling asleep, awakening early or later than desired, interrupted sleep or not feeling well rested, increasing irritability, lethargy, decreased attention span, disorientation, dark circles under eyes. Nursing measures to promote sleep include prepare a restful environment, promote bedtime rituals such as praying, bathroom, and whatever else the individual engages or would like to engage in. Offer appropriate bedtime snack and beverage. Avoid caffeine. It's a stimulant and would tend to keep the person up. Reduce fluids 4 to 5 hours before bedtime so that they won't be awakened to go to the bathroom. Promote relaxation. Help patient come up with effective measures to decrease worry. Verbalizing. Worrying is counterproductive. Give the problem over to someone else. You can also provide back rubs to the individual. Comb or brush hair. Promote comfort. Administer pain medications. Assess pain scale on a scale of 0 to 10. Provide extra blankets. Nursing comfort measures should be implemented before medication given. Respect the normal sleep-wake pattern of the individual. It's hard to do in a hospital environment because of the needs the patient often require. Discourage daytime nap unless it is a part of the client's routine. Avoid unnecessary disruptions. Try to coordinate your care as much as possible. Sleep medications such as sedatives and hypnotics produce sleep. Anti-anxiety medications disturb REM and non-REM sleep to some degree. Teach client the danger of withdrawal of sleep medications. Anxiety clients won't always tell you that they are addictive to sedatives. Therefore, you need to know indicators of addiction and watch the client monitor them very closely. Signs and symptoms of sleep medication withdrawal: weakness, tremors, restlessness, inability to sleep, anxiety, increased pulse rate, seizures with barbiturates, can lead to death. Psychosis. Please monitor the client for evidence of withdrawal. Body alignment, mobility, and activity. The elements of mobility are alignment, balance, and coordinated movement. It's a function of the skeletal muscles, gives the body shape, protects bone, maintain posture, cause movement. Essential elements of mobility include joint mobility, station, gait, exercise, mobility tolerance. And we're going to stop at this point.